Hi Titans, and welcome back to another episode of In Focus, where we sit down with our very own CSUF professors to discuss current affairs. Now, mental health concerns were at the forefront of the pandemic, leaving many in angst and uncertainty. But how did the pandemic affect our very own students? Joining us today, we have Dr. William D. Marelich, Professor of CSUF in Psychology, to share some insight on this topic. Thank you for joining us, Dr. Marelich.
Well, thanks for having me today.
Yes, of course. Why don't you tell us a little bit about yourself?
Sure, I'm Professor of Psychology here at Cal State Fullerton. I teach some of the more advanced quantitative methods and health psychology courses within our department. I also have active research programs in the area of HIV/AIDS, addressing HIV/AIDS and how that affects families, and as well as health decision-making.
Gotcha. So again, mental health concerns are at the highest at this point in the pandemic. In what ways has the COVID-19 pandemic affected the mental health of our students here at CSUF?
It's had an effect at university students across the United States and worldwide, so we're aware of that. One thing, though, I do want to point out straight up is that, it's not a simple cause and effect situation in terms of COVID-19 and then issues of well-being and mental health. So what happens is there's something in the middle, and it has everything to do with coping and coping strategies. So a large stressor is out in the environment. In this case, it's going to be COVID-19 and other stressors associated with that. And then there are certain coping strategies that kick in for how individuals deal with these particular stressors. And then we get these particular outcomes, in this case, issues of well-being or negative effects on well-being and negative effects on mental health.
I see. And I know that semester, from spring 2020 and on, there was this transition from in-person learning to virtual learning. How might that have affected the learning styles of the students?
Well, so absolutely it had an effect. And here's one thing, I have a colleague in my department, Dr. Lisa Mori, who actually had the wherewithal the end of spring 2020, so we were already in virtual mode, to collect data, online data, from students here at the university. So she collected data from 800 students who were taking courses within our psychology department. So we're not just talking about psychology majors here. We're actually talking about students from across Cal State Fullerton who happen to be taking courses here within our department. And she asked them, this 800 plus students, all these questions about, how are you doing, how are you feeling, how much anxiety are you experiencing, how much stress are you experiencing due to the shutdown. And what's interesting is that she asked a number of different questions, but I do want to point out some key questions she asked that I think really answer your question. Mm-hmm. The first thing is in terms of academic engagement. Okay, so one of the questions she asked was, okay, before the shutdown, how engaged were you in terms of in academics, in your coursework, everything like that? And only 16% said that they were disengaged, pretty much not engaged at all, right? So we're looking at 84% who were saying, yeah, I'm engaged, I'm showing up, I feel like I'm involved in the classroom, et cetera. So then a follow-up question was, okay, now after we go virtual, so now we're virtual, how engaged are you with coursework? And that 16% disengagement went up to 61%. So it's a huge chunk suddenly that are disengaged. So you're only looking at 39% who feel like they have any type of engagement with their classes and their coursework. And again, for learning to take place, generally you need students engaged in what they're doing in classroom work and feeling like they're part of something. So that was one finding that I think is significant. Another finding she asked was, okay, after we went virtual, how much academic stress are you experiencing? And 70% of these 800 actually said they were experiencing moderate to high levels of academic stress. In other words, they were actually worried about their classes. They were worried about their grades, how they were doing, et cetera. So that's a very telling point as well. And then two other things I do want to mention too. She asked the students, gave them a general stress questionnaire, and the findings for that were that 80% of the students responding said that they were either moderately or highly stressed with the shutdown and going virtual. And then the last question that I find just fascinating is she actually gave the students a clinical measurement, which is referred to as the GAD, which is a measure for generalized anxiety disorder. So it's actually a clinical measure. And 75% of the students responded that they were either moderately or highly stressed given this kind of virtual learning environment. And when you get up to 75% moderately or highly stressed out, that's indicative of possible issues with, again, negative effects for well-being and for mental health. So yeah, it really kind of underscores right when we went into the shutdown, students were stressed and anxious, absolutely, and it was affecting how they were learning.
Right, right, most definitely. Let's talk a little bit about the quarantine period, because I know like that just was a wild curveball in itself. So what kind of stress came about that during the quarantine period for students?
Sure. Well, so it's compounded. So just to spend a little time on this. So you had COVID-19 occur, large stressor out in the environment, okay? And on top of that, one thing with COVID-19 right when it emerged was there were a lot of ambiguity associated with it and the rules we were supposed to follow, a lot of unknowns. Mm-hmm. And what occurs this comes out of health psychology, what happens with stress is that we can kind of handle and deal with stress generally, but when you start adding in ambiguity to what the stressor is and how to act toward the stressor, it actually makes the stressor larger, really enhances it, makes it even worse than it was. So you have this kind of compounding effect here of the unknown with COVID-19. So it's even a stronger stressor than what normally it might be when we hear about a virus outbreak or something like that. So anyway, so what stressors were students experiencing? We do know, and this is actually from some data I've been collecting in my health psychology courses. So I've been asking students, and I started doing this just back in January 2021. So we're looking at about 9 months into the shutdown and the quarantine, and so we were all virtual at this time. So in January 2021, I asked students from my online health psychology course, let's talk a little bit about let's do an assignment here. Go ahead and document what stressors, what things you're going through in terms of COVID-19, and then what coping strategies that you're using. And we'll get into coping strategies more a little bit later. But the specific stressors that students were experiencing at that time, we're looking at 9 months into the shutdown, were simply this idea of everything you heard about on the media. So you're looking at individuals having to move back home. These are Fullerton students. And again, these are embedded within the narrative. So this isn't me coming up with these things. It's the students actually producing this. So students having to move back home, students losing their jobs, so there's no income. Students having family members die, extended family members die. Family members and extended family members in other countries dying and not being able to go to funerals, not being able to visit folks in the hospital who are sick. And I'm not making this stuff up, pets dying. You're having individuals' close relationships, love relationships break up. A few of the students had kids, and there were some reports of, and I can't go into too much detail about this, some reports where the kids were actually taken away because there was a divorce going on and stuff like that. And it's like, wow, just these cascading of events. So these are all big stressors associated with this domino effect of COVID-19. On top of that, just in terms of learning, students were reporting that they had issues with Wi-Fi, couldn't hook up into Wi-Fi, didn't have appropriate laptops to do live streaming for classes and stuff like that, and they didn't have a quiet place to work, and a lot of still places, coffee houses, wherever else you could hook up, you couldn't go and work there. So students were really having an issue trying to work in their rooms and trying to figure out a way of even accessing academics and to be able to just do their coursework. So that's just in a nutshell what the different stressors were out there that were happening during quarantine. Absolutely.
Yeah, it was a very, very difficult time, just that transitional period. And as you mentioned, you I mean, not you personally, but a lot of the students did experience that separation from, friends and family and having to deal with loss. It definitely was a big impact mental health wise.
Absolutely.
I wanted to touch base on the data, from 2020. How did that differ from the years prior?
Sure. So, and I'm glad you asked that because as somebody who's a researcher, one of the first things I always ask when I see data like this, I'm like, okay, 75, 80% stress and anxiety, from Lisa Mori's study, so we're looking at, well, what was the baseline? Because, I mean, if the baseline was similar, then there's no uptick. And although we don't have direct information from Fullerton from 2019 or 2018, we actually do, there are a series of national studies across colleges and universities that by a few different entities that actually went out and just in general were assessing what was going on with stress and anxiety. So we can kind of view these as kind of baseline measures, and they generalize well to Fullerton. So those findings from a couple different studies showed that about 50% of university students had an elevated level of stress. This was in 2018 and 2019, just being on campus, being a student. So about 50% were reporting elevated levels of stress. About 50% were also reporting elevated levels of anxiety. So if that's the baseline, 50%. For stress and anxiety. Well, if you take a look at Lisa Mori's study, that was published, I believe, last year, we're looking at 75 to 80%. So that's a huge uptick. So, was there a change from prior years? Absolutely. You're getting a 25, 30% uptick in terms of stress and anxiety for students, and that is and that's on top of everything else going on in individuals' lives. So yeah, big change from earlier.
Yes, I totally see that. I really do. Now in 2022, we are slowly transitioning back into in-person, which is so fortunate to be able to experience a lot that's going on campus. And, the students are being able to engage more in their classes and actually be in person to see their professors. So I wanted to ask, what do the numbers look like now in 2022?
Sure. So we don't have any direct data, again, something like percentages, much like Lisa Mori's study or even the 2018, 2019 studies from baseline. But one thing I can share with you, and again, it comes from this assignment on coping that I've been giving students. So I'd already mentioned the findings in terms of stressors that were happening in January of 2021. So, and I've been giving this assignment over and over again. So my most recent ask of students was in January 2022, so just a few months ago. And what I saw in those narratives is it's a fascinating change. It's what's happening with the stressors. And I do want to get into coping strategies here, which I will in just a second. But what's happening with the stressors now is the stressors are still there, except they're a little different. So what's happening is that you're not getting as much death. You're not getting as much serious illness. It seems like in terms of stressors, students have kind of figured out their love relationships and their relationships with their parents. They've figured out ways of negotiating if they're living back at home. Things are reopening, so there were comments of, during the pandemic, almost in terms of past tense, like during the pandemic I lost my job, it was hard to find money, but now I'm working again, now this, now that, now the other thing. So things are much brighter. The number of kind of these harsh stressors, and in the health psychology literature, sometimes we call these stressful life events. So the number of stressful life events actually were reduced, and even if they weren't reduced, they were muted in some ways. It's like, this was really hard for a few months, but then I figured it out. And the one thing which brings me to this, where I'd mentioned at the beginning that you have COVID-19 and we have these outcomes, but in the middle is coping and coping strategies. And so from the earlier narratives from January of 2021, when lots of negative things were happening, the coping strategies, and coping strategies can be broken up into positive and negative coping strategies. And both tend to work. It's just that the negative coping strategies don't work as well, and they're much more short term, while the positive coping strategies are much more long term. So in terms of the earlier narratives, there was reporting of coping strategies, and these are kind of standard coping strategies that are in the literature. The coping strategies that were shared there tended to be a little more negative as opposed to positive. Negative coping strategies include things such as alcohol and drug use and abuse. So whether it's cannabis, whether it's alcohol, prescription, non-prescription drugs, there appeared to be people were very open about doing that. In the narratives from just a few months ago, 2022, not seeing a lot of that. Not in terms of coping strategy. Other coping strategies from the earlier narratives were things such as venting, complaining, and in the narratives just from a few months ago, less of that. And again, we always hear like, well, venting's good. It's like, well, venting's good for a while, and then at some point you're not taking any action on it. And when you're just venting, then you're just complaining, and then things never get better. So you're seeing other things too. In the more recent narratives, you're seeing people talking about, I figured out how to plan things out. That's a positive coping strategy. Sitting down, making a plan. How am I going to do this? I'm going to try to get reemployed. I'm going to try to get some money this way. You see individuals more likely reframing. And reframing's like, it's this thing like, hey, we're in shutdown. How can I turn this to my advantage? I'm going to learn how to cook. I'm going to learn how to do this. I'm going to be able to read more. I'm going to be able to do these other things. So you see a lot more people, students, just in the last 2 or 3 months, the last time I assessed this, reporting more reframing. Also reporting another positive coping strategy, which would be just acceptance. Hey, this is how it is. I'm going to get used to it, and I'm going to move on. There was less distraction being used. So distraction was something that was heavily used in the earlier narratives. Distraction is, I'm going to play video games. I'm going to watch a lot of television and streaming and do all those things. And again, in the short term, that stuff works great. Takes your mind off things, but long term it doesn't solve any problems. So that was the big, there were these big changes in terms of stressors kind of experience. They were less serious. In terms of life events, they were like I said, less serious, less impactful. And not only that, but you get this change in terms of the coping strategies being used. And then one other thing too, a number of the students just a few months ago were writing how they tried some of the more negative coping strategies, and they realized they were like, hey, these aren't working, and they actually switched. And that's important to know about coping and coping strategies, is that there are a whole bunch of different things you can do, and you can use multiple coping strategies, not just pick one and use it. So you can use multiple, and if you find one isn't working, try another. But you have to know what those are and what to do. So I described a number of them here, but a lot of these things you can find in other places as well.
No, you are absolutely right. This is the time that I remember a lot of small businesses arose, just from that time period. A lot of hobbies, you were able to really find yourself with different opportunities in that time. So like you said, it probably was one of the biggest coping strategies that, that happened during that time. Yeah.
Yeah, and then one other thing too, in terms of change, so I'm reporting a change from narratives that students had produced from early 2021 to early 2022. But one thing also, we're looking at different cohorts. These aren't the same students, et cetera. I do think it's a good marker for what's going on. But the one thing that also could be going on too, and again, I'm trying to be positive here, but again, as a researcher, I come in and be like, well, what if the people who really struggled with the pandemic and issues associated with the pandemic, did they continue their education or not? And so the one thing that I might be missing from these most recent narratives are the people who just weren't able to kind of piece it together and continue their education, or maybe they dropped out of school. Who knows? We know, for instance, the Los Angeles Unified School District, it was estimated that maybe about 6% of students in high school disappeared. They just disappeared. Like they never graduated, never came back, that type of thing. And those numbers, I would guess, and that was as of last year, those numbers I would guess probably are about the same. So if we generalize that to Fullerton and a university, a large university like this, it's possible that the people who were the most affected, negatively affected in terms of well-being and mental health, once we got a year or so into the pandemic, they pulled out. They had to go take care of family members. They had to go move. They had to go somewhere else. Who knows what happened to them? But those might have been some of the people who are doing the earlier narratives, for me, those people then might not be represented in the narratives that I just collected a couple months ago, if that makes sense.
Yes.
Yeah. So there's kind of, poof, gone.
Yeah.
And who knows? So, but I do try to be more optimistic about this and say, yeah, I think there's some positive changes going on.
Yeah, that's great. We do need more positive change. Are there any options that you recommend for students to help boost their mental health?
To boost mental health, try to get a sense of what some of those negative coping strategies are, and maybe try to avoid them. Because again, in the short term, they may seem to work, but in the long term, you're not going to make any progress forward. So, and I know it's especially university and college life. It's hard to pull back a little bit on drug and alcohol use. A lot of people turn 21 for the first time and say, hey, this is fantastic. We can go out and do this stuff. And I get that. Folks should go out and have some fun. But if you find that you're a daily user of whether it's cannabis or alcohol, and I mean a user, you're going for more than 2 or 3 drinks, which is kind of a yellow flag for, if you're doing that daily, that might be thought of as something you might want to pull back on, or daily cannabis use, et cetera, or other legal or illegal drugs. It's kind of like, maybe that's not the best way to go. Or if you find yourself venting, turn it around and be like, maybe I don't want to vent, maybe I want to actually ask for help. And one thing too, in terms of coping strategies, so I was talking about trying to move away from the negative coping strategies, and some of them can even be destructive, like drug and alcohol use. But on the other end, try to adopt more positive coping strategies. This is what students can do. So what would those be? Seeking social support. That is a huge part of what we see going on in terms of coping strategies in health psychology. And when we're talking about social support, we're talking about seeking both emotional and instrumental social support. So emotional is just, it's emoting to someone, hey, I feel a little lost, hey, I feel a little sad, I feel kind of alone. That's not venting, that's reaching out for help and contacting friends and family members, whatever, and trying to find a group of people or just one person that's going to say, yeah, I feel the same way, let's talk about that. And this again is, that's just connecting with somebody in your own life. Instrumental support is actually asking directly for help. Hey, how do I do this? How do I make this dumb Wi-Fi thing work better? How do I get hooked in? I still have virtual classes. How do you pay attention, to this? What do you do? It could also be asking for money from parents or from friends or extended family members. It could be asking for anything, but literally it's reaching out, whether it's tangible or more directly instrumental. That's a good thing. So realize that you can do that. So what I recommend students to do is maybe try to steer away from some of these negative, kind of sometimes even destructive coping strategies, and move more toward some of these positive ones, seeking social support, reframing, acceptance, planning, et cetera. Those would all be my recommendations.
Yeah, those are very good recommendations. Now that we are on campus again, is there anywhere on campus that students would be able to go to reach out for help?
Sure, and one thing, just to directly answer your question, it's the CAPS group, so that's Counseling and Psychological Services, and they're available over in the Student Health Center, and also I was just reading online. The best place to look is online, of course, because things move around. But the Student Health Center, and also Titan Hall on the 3rd floor has the CAPS unit there as well. And I'd probably start at the Student Service Center, and I think they're just larger and it's been more established there. But one thing our university I think did well was to get the word out to faculty as well as hopefully to students, at least from what I heard, is that if there are some issues, if individuals are experiencing some stress and any issues at all dealing with COVID-19, that they should go ahead and reach out to CAPS. And I'm sure CAPS was initially, I don't say caught off guard, but that's a lot coming at them, and I think they've mostly have figured out how to handle the incoming. I mean, we have with graduate programs here and extended education and everything. We're looking at close to 40,000 students associated with Cal State Fullerton, and and any counseling unit at any university is going to have to figure out a way of juggling things to make this work. But that would be the starting place. And even then, faculty, we've been instructed that, hey, if you do see a student where you believe there are some issues, gently reach out to them and say, hey, CAPS is here. Why don't you go ahead and reach out to them and figure out, try to set up something. And the one thing with what CAPS has to offer is that they will offer up to 4 counseling sessions, one-on-one counseling sessions with students. That's all for free because it comes out of fees that students pay. And maybe 1 or 2 more sessions on top of that. I'm not sure. Even the website was a little vague about that, but it said at least 4, which is good. They also said that you can actually join group counseling, which continues to be free up to a point, I think. And then on top of that, if you need more personal counseling, one-on-one, they will go ahead and refer you to individuals outside of the university. That you'd have to pay for out of pocket or through your insurance.
I see. Okay, well, that's really good to know as far as the CAPS program. So it is majority free for students to go out and be able to utilize those services.
Yeah, and what CAPS has to offer is it's I don't want to be that specific, but it's cognitive behavioral therapy, which is kind of a short-term kind of therapy thing, which is effective. There's always these arguments out in the clinical literature, what's better, short-term therapy approaches or long-term. The general consensus is long-term's a little better, but the short-term certainly does what it needs to do. Both have, and again, based in health psychology and the psychological research literature, both types of therapy have at least medium or moderate levels of effects, which is good. If I'm a researcher and I get a medium effect size on something, I'm like, well, this is fantastic. And so does this type of counseling work? Absolutely. I mean, it's better than doing nothing. Mm-hmm. So, So there you go. So students should seek it out.
Yeah. I've actually been able to see a lot this semester that they have what they call puppy therapy.
Really?
So it's been really great to be able to see the puppies on campus, and students are able to go and kind of de-stress from the stress of the semester, whether it's midterms or finals. It's really cute. So I do recommend going online and checking that out.
Very cool. Yeah, very cool.
But what do you recommend telling students who don't feel comfortable to come out and ask for help?
Right, and that's a great question, because there are students, for a lot of different reasons, don't want to reach out to any type of, first off, admit that, hey, maybe there's something a little bit, I need to take care of something here, and they're a little embarrassed by it. And also within certain cultures, sometimes it's not acceptable to, like, oh, I'm going to go see a clinician. You are, and it just isn't held up as something that's appropriate. So you do have some students that feel these pressures based on their culture, their family, or even internally how they feel, who they are. They're a little bit embarrassed by this. So what do you do? And although I'm not a big fan of saying check the web, even in my health psychology class, I'm kind of like, there's a lot of not so good stuff on the web. But one thing I would recommend is drilling a little bit more into the coping strategies and trying to take a step back and say, okay, how am I coping with this? What are my, and literally list your behaviors. Okay, I'm doing this, I'm doing that, trying to dealing with this stuff. And then evaluate what you're doing in terms of good and bad, just to make it black and white there, right? So it's kind of like, okay, these are the good behaviors I'm doing to deal with these stressors. These are maybe the bad behaviors. And really, if you take a look at those things as good and bad, it actually gets into the coping strategies, positive coping strategies, negative coping strategies. And if you look into, hey, I'm doing cannabis daily to kind of soften the blow of life. I'm drinking 4 glasses of wine a day. I'm drinking way too many beers. I'm doing this. It's like, yeah, that's probably not that great. So circling back around to the web stuff, you can actually look up on Google, or I might even say, take a look at Google Scholar and look up coping strategies and positive and negative coping strategies, and try to get a decent listing. And I gave a pretty good one here really quickly, but what are the more positive coping strategies? And then from there, try to integrate some of those positive coping strategies with how you're dealing with these stressors. And that might, help you in the, move forward. Because a lot of times stressors that we do experience after a few months, whatever the stressor was, it goes away. And for whatever reason, I always use an example. As sad as it is, like death of a pet. And initially the first couple months, horrible. 6 months later, it's like, yeah, I mean, it's less painful. So what happens is things pass sometimes without any counseling at all. So you have to kind of know that these things will pass in general. But if you feel like that they haven't, trying to take a close look at the coping strategies you're using is going to help. And then the other thing is, again, reach out to CAPS and take that step forward. You don't have to tell people you're doing it. It's not that CAPS isn't going to announce it to the world and your family. You can go ahead and make an appointment. It's confidential. It's taken care of, and they'll work with you and go from there. So again, I understand that there's students that are really tentative with this, and I just don't want to suggest, well, just go do it. Because it's like, some of these stressors will pass. Others you can kind of deal with yourself if you have a sense of what's going on with your own coping strategies. But in addition, go ahead and take that step up and go, okay, close your eyes and go, okay, I'm going to contact CAPS, and then go from there and see what happens.
That's great, really. Is there any advice that you have for anyone, whether it's student or faculty members? Do you have any advice for anyone watching right now?
Well, I think I've given a lot here, and so I don't want to overstep boundaries. But one thing I do cover quite a bit in my health psychology courses is this idea of getting a sense of who and what you are. And as university students they're learning. That's one thing you learn at a university. You get a sense of identity, a sense of self, and so therefore, then, if you get a sense of if you're developing a sense of your own self, you should start developing a sense of how you cope with things, and then circle back around to try to figure out what your general coping strategies are, and then try to spin them more for positive as opposed to negative. That's my final thought.
That's great. Thank you so much for meeting with us, Dr. Marelich. It's been great having you here.
Well, it's been wonderful, Vanessa. Thank you so much.
Yes, of course. Thank you for tuning in, Titans, and another big thank you to Dr. Marelich for sharing this valuable information with all of us. Until next time, I'm Vanessa Castaneda, and this has been In Focus.